All right, now I want to get a little bit into image interpretation. So this is just a real quick introduction for someone that's never had any amount of radiology before, and we're just going to focus on the border, describing the border, and a little bit of the internal structure and the location of a lesion. So when we're talking about the border of a lesion that you see on a radiograph, these are the two major categories, well-defined or ill-defined. Well-defined meaning you could confidently outline the borders of the lesion with a pencil. I kind of put in parentheses, maybe with a fat crayon. You can leave a little bit of wiggle room there. But ill-defined is more when it's tough to delineate the border of the lesion. And so we'll show you what that means. All right, this is a lesion that is well-defined. Some of these areas look a little bit blurred, but the fact that part of the border looks very well-defined and has this distinct radiopaque line around it, we call that corticated. That is a well-defined lesion. There's our fat crayon outlining it. And compare that with this one, or contrast that with this one. Does that have a nice, smooth, well-defined border? Does the border go to here? Well, maybe it extends all the way out here into the marrow space, and it's kind of ragged. You know, all these things go along with an ill-defined lesion. Those tend to be more inflammatory or malignant, what I would categorize as aggressive. And so you may draw your line like this. Someone else may come in and say, no, it extends out to here. And so that, by very definition, is an ill-defined lesion. Here they are side by side, are well-defined or ill-defined. So hopefully you can start to recognize this. All right, so this is kind of the major subcategory under well-defined. Is it corticated or is it non-corticated? In that last well-defined example, we pointed out a thin white line around the lesion, and that's what I indicated as corticated, a thin, fairly uniform radiopaque line. And that typically indicates that it's a cyst or benign tumor, whereas it can be non-corticated, where it has a sharp boundary, a distinct line between where it's radiolucent and radiopaque, but it doesn't have that thin radiopaque rim around it. All right, so what do you think of this one? Is this corticated or non-corticated? Do you see a thin radiopaque line around it? Yeah, it looks like a thin white pencil line around it. That's exactly what we mean by corticated. So that's a good example of corticated. What about some of these lesions indicated? They have a distinct sharp border. There's multiple lesions here, but I don't see a distinguished cortex like we did on that previous area. And so these are well defined, but non-corticated. Let's jump ahead to internal structure. And then basically we're talking about, is it light, is it dark? So is it radiolucent, meaning dark? Is it radiopaque? Or is it mixed? Does it have some texture to it, where parts of it are radiopaque and parts are radiolucent? These two lesions are very radiolucent. They're very well defined. I would say that they're corticated as well. This was that example of a corticated one, even though on the posterior part of it, it doesn't appear corticated. But if I see part of a lesion that shows a distinct corticated border, I'm going to go with corticated, because that corticated border means that it's slow growing, it's more benign, it's one of the lesions that tends to develop a corticated border. All right, and these are radiopaque lesions. This one's very well defined, very sharp bordered, maybe not nice and smooth like those previous lesions we showed you, but it is well defined and it's largely radiopaque. This is a radiopaque lesion, maybe a more ill-defined border because it kind of blends in with the surrounding bone. Hard to distinguish where exactly it ends, where it begins. But both of these are radiopaque. So we're talking about the internal structure, not the border of it. This one is largely radiopaque, but it does have this radiolucent rim around it. It has these intermingled arms of radiolucency inside. And so that's more mixed. I could describe this as radiopaque, but I would also describe it as mixed because of that feature with some of the radiolucencies inside. And this looks like an altered trabecular formation. See, here's normal trabecular bone, like you expect to see with these distinct lines of trabeculation. And here it looks like those trabeculae just became smaller. The internal marrow space became smaller. It kind of looks like an orange peel, or sometimes this is described as ground glass in appearance. So that would be mixed. It still has an ill-defined border, kind of a blended border. Then, of course, you want to describe the location of the lesion. Certain things tend to develop in and around the roots of teeth, and you look at how it interacts with the roots of these teeth, and the PDL space remains intact. This might be separated from the root rather than growing from the root. But you describe where it is, you describe the size. This is that well-defined lesion we showed you again. A more advanced topic, but you describe the effect on other structures, how it's tilting these roots outward. But you definitely want to describe that it's in between the roots of teeth 29 and 31, right? And it's expanding from there. So all of these first three are in the odontogenic region, meaning they're around teeth. What about this one? It's close to the teeth, but this is actually within the maxillary sinus, and that makes a big difference because certain things arise within the maxillary sinus and different things arise within the bone around the teeth. They tend to be odontogenic things. And so that was a real quick rundown of how to describe things. That'll help as we get into the caries lecture. You can notice that caries tends to be ill-defined, a bit of a blended border. That's one of the ways that we distinguish caries. It's radiolucent because it's starting to demineralize, but it has an ill-defined border as opposed to a radiolucent restoration or some other things that have a more well-defined border.